Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video presentation, I wanted to speak to you very briefly the basics aspect of arrhythmias. What are arrhythmias? Well, arrhythmias are irregular heart beats. Normally, the heart beats at a certain pace, like 70 to 80 per minute is normal. Over 100 is called tachycardia. Less than 60 is called bradycardia. Now these are the terms I'll start to have you familiarize, so this way we can follow through this presentation in the next few minutes. So anything less than 60 is called bradyarrhythmia. That means less than 60 and irregular. Anything more than 100 and irregular is called tachyarrhythmia. So these are rapid arrhythmias. We'll talk about them in a second. So there are rapid arrhythmias which are more than 100, the heart rate, yep. And less than 60 are the slow bradyarrhythmias or the bradyarrhythmias. So let's do one by one. So the rapid tachyarrhythmias can originate from the top chambers. Let's look at this schematic on the left panel. They can originate from the top chambers, or they may also originate from the bottom chambers. Remember, the top chambers are the atria, right atrium and left atrium, and this is right ventricle and left ventricle. Now, what kind of arrhythmias can originate from the top chambers? Well, the commonest one is atrial fibrillation. Atrial fibrillation classically occurs in the LA, the roof of the LA, or the left atrium. And normally it is situated, the focus, where the short circuiting, if you will. Remember, it's an electrical impulse. We have a generator in the house to give electricity to the rest of the house. So here's the generator. It's called the pacemaker that we already have. The nature has given it to us. It sits on the roof of the RA, or right atrium, right here. So that's called a sinus node. So the sinus node sends an electrical impulse. It goes to the AV node, which is also sitting in the right side of the right atrium, but at the bottom or the floor of the right atrium. Then it passes through the bundle of His, and then it divides into two sets of fibers, one going to the right and the other going to the left, and these are right bundle and left bundle. And then they branch off into smaller fibers which supply the rest of the ventricles, and those are Purkinje fibers. Okay, so we had dealt with them in a previous video presentation, so just to recap quickly how the electrical impulse travels each time, so that the atria contract first, and then the ventricles fill up, then the ventricles contract, they empty out, while the atria are filling in. So it's a very, very concerted way of nature's contraction and relaxation going on within the heart. So this way it's a forward flow maintained from right upper to right lower and left upper to left lower chambers. Okay. So now what happens is when you have rapid arrhythmias originating, say from, now let's move on to this panel again, originating from these pulmonary vein mouths, if you will. These pulmonary veins are opening up into the left atrium, and these are small little foci, small cells, if you will, and they short circuit. So what happens is, even though the electrical impulse is traversing normally in that individual, there's a short circuiting happening here in this area, and that quote-unquote short circuiting generates an atrial fibrillation, atrial flutter, or several APCs, or even supraventricular tachycardia. But atrial fibrillation notoriously, quote-unquote, starts here in this region. The rest of them, they can occur from either of the atria. Okay. Ventricular, on the other hand, those are arising from the bottom chambers, and they are premature beats. Those are called VPCs. They may occur in combinations of 2 or 3, so they are called couplets or triplets. And sometimes they are persistent beyond the 3. They are called VTACs. And they can become non-sustained VTACs. That means they can continue for a longer time. And ventricular fibrillation, that is life-threatening. That means death is just about to occur. So that's a life-threatening arrhythmia. So these are very, very important arrhythmias that one sees, which are very rapid. Now, just imagine yourself. You're trying to, I'll give you an example, like you're clapping. If you clap and move your hands far apart and then try to clap, you can make a nice sound. But if you were to make if I told you not to move your hands too far apart and try to clap, I don't think you can produce that much of a sound. Why? Because you're not giving enough time to clap. So the whole idea is wanting to see that the ventricles should fill up before it can eject. But if the rapidity of the heart rate or the tachyarrhythmia is such that the rates are very, very high, like 150, 200, 225, especially in the case of VTach and VFibs, the chances of filling up is extremely, extremely low, and these ventricles don't fill up and the patient either passes out or dies. So it's a very, very life-threatening arrhythmias, as I said, so one has to be very, very cognizant about these arrhythmias. So, but we'll talk about the treatments later on, but just so that you know, the arrhythmias can be recognized in this fashion and they can be discussed. Slow bradyarrhythmias are the ones where there are blocks. You can have a block here, that's a first-degree block. A second-degree block occurs here, and a third-degree blocks occur here at this level. So in general, just not going into the specifics, but just so that you understand that the first-degree block, a second-degree block, and a third-degree block slows the heart rate. So these are called bradyarrhythmias. Now, the take-home message here is, remember the cardiac output? Cardiac output is the amount of blood that's pumped per minute through this aorta. That means each stroke or each left ventricle contractility is a stroke volume. So if the stroke volume is going down, or if the heart rate is too rapid or too slow, the cardiac output will suffer. Now look at it this way. So if the heart rate is too slow, the cardiac output by this equation will be going down. But if the heart rate is too rapid, don't estimate that the cardiac output is going to be higher, because the stroke volume will actually be compromised, because the heart rate, remember, is going extremely fast in those individuals, so the stroke volume will go down and therefore the cardiac output will go down. Anyway, these are the basics of arrhythmias and the importance of arrhythmias. I've tried to sort of outline here because they are very, very important for us, and I hope you enjoyed this section. Thank you for your attention. Bye. Tell your friends and spread the knowledge. Bye.